possible to change the color from yellow to the cremish or the white? People say as a white, but
Yeah,
you have mentioned that it is not proper white. It is a creamy kind of color. So,
right.
is it possible to change the color from the yellowish to the original one?
Yeah, it's possible. It's possible, and like it's like skin. Many people go for bleaching of the skin to lighten the complexion. Similarly, the tooth can be lightened. Tooth color can be lightened one shade, two shade, three shades by application of bleach, dental bleaches. Yes.
Okay. So, can you please explain the process of this whitening? What you said about bleaching of the teeth and all. So, would love if you can explain the proper
Okay.
detailing of it.
Okay. So there are three level of attempt to lighten the tooth color. One is over-the-counter therapy, over-the-counter medicine. Some toothpaste they claim that if you use this and that will lighten the color of the tooth, and many people do that. Maybe the effect is not very effective. Second one is home bleach, which will be prescribed by doctor. That will for that a tray which is made for the tooth of the patient properly. Uh, that will be fabricated, and then some bleach will be given to the patient. You apply a little bit, put the tray, keep it for some time. It depends on different formulation, and then you remove it. So that is done by home bleach by patients, but according to doctor's fabrication of the tray and prescription. And number three is some very fast and effective way of doing bleaching is in-office bleach,
Okay.
means which will be done in the doctor's clinic. The tray will be similar. The bleach will be maybe composition will be different, and it will be activated with light or maybe laser light. So that's instant, that fast. Maybe the changes is little better.
Okay.
Yeah.
So, is whitening permanent?
So like any bleaching, we cannot expect that bleaching of the tooth is permanent. Uh, the patient, the person who go for bleaching, they have to undergo touch-up bleaching once in a while to maintain the lighter shape.
Okay. So, how to maintain tooth whitening for a longer time?
So patients should avoid chewing gutka, tobacco, um, colored food. They have to avoid, and good oral hygiene, of course, they have to take.
Okay, in the home food also they should avoid all these coloring foods, right? Because that also can add on the color to their teeth.
So after bleaching, yes, but normally the benefit of the many masala is so much that I will not suggest avoiding all those things.
Okay,
But after bleaching, yes, if somebody is very particular about the color, they don't want to, so they should avoid.
okay. Is there any side effect of tooth whitening?
Yes, so it has to be done correctly. The nowadays bleaches are very safe, and the protocol is developed, but still after bleaching, there can be, hypersensitivity of the tooth. If the bleaching is not done properly, it can damage adjacent soft tissue in short term. Yeah.
Okay. Now we are going to talk about the very common problems according to the teeth and the mouth and all. We will talk about the bad breath and the malodors and all.
Mhm.
Sanjay, just tell me one thing. What are the causes of bad smell from mouth?
Okay. So, malodor or bad breath from the mouth, to some extent, is common because we eat food and food gets stuck to the tooth. And if you don't do proper brushing after each and every meal, then bacteria are there in the mouth. They will act on the food, and then there will be smell. Little bit of smell can come after 2 3 hours of taking food. But too much smell points out to the area of too much food lodgement. There is catchment area in terms of big cavities. The food is getting deposited there, it's lying there, and then it's putrefying. is decaying and then resulting into smell. There can be gum diseases, the dental pockets. There can be pocket between the tooth and gum, and which will collect the food. And then there are some germs, some bacteria, which produces bad smell. These are the dental causes, but bad breath from mouth can arise from tonsil, it can arise from lung, it can arise from sinus. So these are also causes of smell,
Okay, so
bad smell.
there can be multiple reasons for the bad smell of the mouth. It's not only because of the cavities. It's not only because of the bacteria and the virus of the mouth and all. It can be through the lungs and through the sinus and all. So
Right.
we highly recommended to all of you to check up with the doctor itself. He can guide you well properly. All right.
Yeah.
So Dr. Sanjay, just tell us one thing. What need to be done to get rid of bad smell?
Um, so brushing, mouthwash, restoration of the tooth cavities, uh, treatment of gum diseases, tonsils should be checked, tongue should be clean. Tongue, again, the coating on the tongue can result into bad smell. So after brushing, uh, it's a good idea to clean the tongue also.
Okay, so every time this is really highly recommended to clean the teeth properly while ever you are having any kind of meal and all. Definitely, you cannot brush every time, but kindly.
Rinsing, you can do rinse. We can rinse your mouth. You can massage your gums.
Okay, so massaging of gums is also very important, and cleaning the tongue is also recommended for to avoid the bad smell. All right.
Right.
Now, Dr. Sanjay, we will talk about the very common problem these days. Like, like you can see majority of people are having, they're consuming gutkhas and tobaccos and drinking and smoking and all. All these stuffs are also going on in the society. So what kind of dental problem these people can create or these people can attract while using all this stuffs?
Okay. So gutka and tobacco, smokeless or uh, chewable tobacco can stain the teeth. It can lead to metaplasia of the soft tissue. The inner part of the cheek or tongue will get some changes. It can lead to you know um, cancer. So it's better to avoid all those things. Uh, Alcohol per se, there is no direct damage to the tooth structure with alcohol, but alcoholic will may not brush properly, may not maintain the oral hygiene. I don't know. So there is a direct connection between. There is some connection between the chewing or smoking and the cancer.
All right. So this should be avoided chewing tobacco, smoking pipe, and all those things because it has got a direct connection to your teeth, and definitely you may attract a serious problem in the coming days if you are regularly having all those things. Now,
Right.
about
And I must add one thing.
yeah.
Uh, betel nut, which is used in supari, which we use in pan. If somebody is using that too much for longer, that can leads to oral submucous fibrosis. That means reduced opening, gradual reduction of the opening of the mouth to the extent that maybe one finger will go, with some difficulty. So people are living with the food by a straw. So that is the very common cause for oral submucous
Yes,
fibrosis.
I got it because many people are they are consuming sweetie supari and all these kind of suparis and all the regular
Yeah.
basis because
Yes.
they are not consuming tobaccos and all. So these are sweet
Yeah.
to mouth or the fragrance is good. So but they are having on the regular basis. I've seen many female also and the like teenagers they are regularly consuming these sweetie suparis and all. So for those, Mr. Sanjay has recommended that this should be avoided because it will create a big problem in the coming days as your mouth will get smaller and smaller day by day and like it can create a so definitely.
Yeah. So it doesn't. Yeah, like cancer or oral submucous fibrosis doesn't happen in everyone's mouth, but there are certain susceptible group of people who are prone to develop this, and we don't know who is prone for that. So it's better to avoid.
Okay. So now we will talk about oral cancers and all. Like since we are talking in that section. So what are the causes of oral cancer, doctor?
So any cancer has multifactorial, causes. Many factors leads to cancer, not only one. But tobacco is implicated. Uh, Gutka, Gutka has complex form of chemicals. In the Gutka, we see, and even after smoking, the burned product has very complex substance, many things, which is potentially carcinogenic. So that can lead to cancer. Oral cancer is very common in India, especially in eastern part of India. Good thing about any cancer is if you are going to doctor, you are in a regular checkup. If you detect it early, then prognosis is good. It can be cured by doing some surgery, and surgery is not small; it's a massive surgery. For cancer, you have seen many people with disfigured faces, so surgery has to be extensive. So if we detect, so detection is the key. If you detect it early, before metastasis, prognosis is very good. But if it metastasizes to other tissues, then prognosis is guarded, variable.
Okay. Uh, so you have mentioned that it is really very common in Eastern India. Basically, it's oral cancer and all. So just tell me one thing, Dr. Sanjay. Is it preventable?
So, in a sense, if you avoid, tobacco, um, in smokeless and chewable form, the risk is less. But still, there are some people, as I told you, this is multifactorial. So there are some genetic predispositions. Some person are genetically prone to develop cancer. There are some people who don't have any habit, but still they get cancer. I cannot say that it's only possible in smokers or tobacco users, but yes, percentage is more in tobacco chewing or smoking group.
Okay. So my last question is, Dr. Sanjay, to you that what are the treatments of these and its prognosis?
Okay, yeah. So treatment of cancer or any kind of cancer are three. One is surgical resection, surgical removal of the cancerous tissue. Number two is chemotherapy and radiation. So these are the three things. Different kind of cancer. The cancer has different nature, and that can be decided after doing biopsy and other certain tests. So different cancer are amenable to different modalities, but mainly surgery, chemotherapy, and radiation. These are the three way of dealing with cancer. Some people will require these three. Many people will require these three forms of therapy. And prognosis is very good if cancer is detected early. But if cancer is metastasized to many organs, then prognosis is guarded.